Welcome my fellow dental practitioners and anyone who's ever wondered about the silent struggle we face within the realm of our profession. Today we're tackling a conversation that's often brushed aside and swept under the rug, but it's high time that we confront it head on. Medico-legal matters. A topic that casts a long, foreboding shadow over the lives of every dental practitioner today, including myself, in an era where litigation has become more prevalent, where lawyers entice with a no-win, no-pay arrangement, and where we as healthcare professionals must grapple with the mandatory weight of medical legal insurance. The burden on our shoulders is greater than ever. Before we begin, I would like to please emphasize that this is a masterclass, and as such, it is geared specifically towards intermediate and advanced level implant dentists who have moral clarity yet are struggling to remain sane with medical legal matters. As we know, there are no two cases that are the same, and there are many options on how to effectively prevent and manage medical legal matters. Like all my lectures, we speak in plain language. We discuss dozens of real-life examples in great detail, providing confidential information with the objective of increasing understanding. But because this is a masterclass, the information herein is very technical, very graphic, step-by-step, and not for patients nor junior dentists or dental students, and also not for the faint-hearted. I have another video that I will provide the link to in the description below, which is much shorter and is geared towards informed patients, dental students, and junior dentists on this same topic. This series is deeply personal to me. I've witnessed the tragic impact of medical legal matters firsthand, tragically having lost friends and colleagues to the unrelenting weight of this issue. The toll it takes on the mental health and relationships cannot be overstated. But that's not all. We're witnessing the rise of patients who seek to exploit the system, those who manipulate and engage in serial litigation, and they're really good at this. We are caught in a quagmire of professional indemnity insurances that sometimes opt for quick settlements even when the claims lack validity, all in the name of expediency. These matters consume not just an enormous amount of time, but also our mental headspace, chipping away at our emotional well-being and straining our personal relationships. It's a lonely and dark and silent struggle that affects us in ways that go far beyond the professional realm. So it's time we break the silence, pop this bubble of exploitation, and stand up for ourselves and our profession. In this medical legal series, we'll delve deep into the strategies and solutions that can bring about change. While every case is unique, we'll dissect real-life examples from my own experience and cases where my colleagues have sought my assistance. Let's get started. When we graduated from university, we were imparted with the belief that practicing dentistry was as simple as working ethically, with empathy, maintaining meticulous records, and striving to provide the best possible care to our patients. If a patient expressed dissatisfaction with their treatment, we were advised to encourage them to seek a second opinion, offer a refund if necessary, and ensure that we had good medical legal insurance in place. However, as those of you that live in the real world are aware, this idealistic approach has become somewhat of a fantasy. The traditional methods and principles we were taught have become outdated in today's landscape. When these guidelines were established, the legal landscape was vastly different, with no lawyers offering a no-win, no-pay arrangement to patients, and the internet wasn't a factor. While the vast majority of patients are a true pleasure to treat, a small fraction can create significant challenges that are not only time-consuming, but also immensely stressful and erode at our professional confidence. The cost of mandatory medical legal insurance continues to rise each year, forcing many of our colleagues to make difficult decisions. Some have ceased to perform certain procedures like root canal treatments or surgical implant placements simply because the cost of the insurance has become prohibitive. This situation has widespread implications across our profession, leading to patients having to seek more expensive specialist care where they could have received the treatment from their trusted general dentist. This not only increases the cost for patients, but also leads to extended wait times to see specialists, negatively impacting oral health. It is paramount to understand that there is a direct relationship between surgical techniques and medical-legal matters, whereby certain techniques are better, quicker, cheaper and faster and more predictable, exposing clinicians statistically to less medical-legal matters. Furthermore, due to limited dental implant training at universities, many clinicians rely heavily on specific implant manufacturers for their education. This reliance can be a Trojan horse scenario, as these companies control the narrative, often promoting techniques and equipment that are financially lucrative to them. Cheaper, more effective and predictable alternatives exist, but clinicians may not be aware of them. As pioneers in dental implant coaching, our channel is dedicated to unveiling cutting-edge techniques that not only make implant procedures more affordable to clinicians, but also enhance their effectiveness. Join us in the professional open educational platform where we share straightforward and predictable treatment methods that revolutionize the industry. We teach the secrets of cost-effective, efficient, and reliable solutions that redefine dental implantology. By way of example, how many times have you contacted your dental implant company representative to report a technical issue with your implants, only to hear that they've never heard of that problem before? This lack of acknowledgement is nonsensical, and they are trained to say that they've never heard of such a problem before. But this is not the truth. That's why we've dedicated this channel to providing crucial information to clinicians, sharing modern, tried and tested methods to navigate these challenges with real-life examples. We aim to empower dental professionals to take control of their own education and decision-making. Medico-legal insurance companies can also present Trojan horse scenarios. Purportedly, they're there for clinicians in their time of need. However, the reality is that clinicians often face challenges alone whilst having to carry the heavy case workload, while these insurance companies focus on managing the cases in the most cost-effective manner to them as underwriters. When clinicians reach out to their medical-legal insurance providers for assistance and receive the response indicating that the provider has no prior knowledge of a similar situation, it can significantly undermine the clinician's confidence. But this is also not the truth. Additionally, and crucially, many clinicians may not be informed that the patient is a serial litigator, as information is often kept proprietary. In essence, clinicians are expected to disclose everything while receiving minimal feedback. In this series, we will share modern methods and strategies that have been tested and proven in real-life scenarios. Our goal is to provide you with the tools and knowledge to effectively manage these challenges and advocate for positive change within our profession. Let's embark on this journey together, where we'll seek not only to find out justice, but also to heal and protect our profession from the exploitation that we feel. It's time to make a difference. Let's get started. We'll start this series by addressing two crucial areas. The first pertains to the documentation of informed consent, and the second involves establishing a case baseline. Subsequently, we will delve into actual medical-legal cases, exploring the allegations made and how they were effectively defended. It is crucial to emphasize that when informed consent is meticulously documented and a case is properly baselined, the odds of a clinician mounting a successful defense increase significantly. Today we will begin with informed consent. We will go through the informed consent documents, and for your ease of reference, I will place the exact copy of these documents in the video description below so that clinicians can just copy and paste. It is worth mentioning that these documents herewith have been reviewed and approved by the industry's global leader in medical legal litigation, and you are welcome to just copy and paste them and not have to reinvent the wheel. We strongly recommend that you provide your patients with a highly detailed information brochure. After addressing any concerns or uncertainties the patient may have, obtain their written informed consent This is imperative. However, it is important to strike a balance, as excessive bureaucratic measures to protect practitioners from malpractice suits should not undermine the core purpose of traditional medicine, which is to deliver the best possible care to the patient. By fostering trust within the doctor-patient relationship, these documents strike a balance between these two elements. I will provide the timeline below in the timestamp for specific documentation if you want to fast track to that specific document, because as clinicians, we are notoriously time poor. Please laugh. Kindly be aware that there are presently 195 nations on earth, each governed by their diverse range of legal systems. This legal framework encompasses common law, civil law, religious law, and customary law, with many nations adopting mixed or hybrid systems to incorporate elements from multiple traditions. We request that you review and adjust the documents to ensure it is aligned with the applicable legal system in your respective jurisdiction. This next document is post-op instructions following dental extractions, and ideally this needs to be handed to the patient in their hand after the extraction. After a tooth extraction, it is important for the stable blood clot to form in order to stop the bleeding and begin the natural healing process. In order to assist this process, often we may place a dissolvable material in the extraction area to assist with clotting. It is recommended that you firmly bite on a gauze pack we will place in the extraction site for 30 to 45 minutes following the procedure. After the blood clot forms, it is important not to disturb or dislodge the clot, especially for the first 24 hours. Do not smoke, drink alcohol, suck hard through a straw, rinse vigorously, or brush near the extraction site for 1 to 2 days. Reduce exercise for the first 24 hours. This will keep the blood pressure lower, which will reduce bleeding from the extraction site. If you have a small post-operative bleed, you can manage this by getting 2 Ceylon tea bags, wetting them thoroughly in water, and then placing them over the extraction site and biting down hard on them. To reduce swelling, place an ice pack or an unopened bag of frozen peas externally over the area. Swelling usually should subside after 48 hours. To minimize and manage post-operative pain, take medications such as ibuprofen or paracetamol. In some cases, stronger prescription pain medications may be prescribed by your dentist. Please take only as prescribed and do not drive or operate machinery if taking narcotic medications. If antibiotics are prescribed, continue to take them for the indicated length of time, even if symptoms and signs of infection are gone. After 24 hours, you may gently rinse your mouth with warm salt water 3 times a day. 1 teaspoon of salt in 1 cup of warm water, swish and then spit out. Rinsing after meals will help prevent food from accumulating in the extraction site. Avoid eating on the side of the mouth where the extraction has happened, and try and eat on the opposite side of the mouth. Drink lots of fluids and eat soft food on the opposite side of the extraction site. Avoid alcoholic beverages and hot spicy foods. You may resume normal eating as soon as you are comfortable. If dissolving sutures or stitches were placed, they will usually fall out in 7 to 10 days post-op. If silk sutures were placed, they will be removed at the follow-up appointment. Please contact us immediately and then provide your telephone number. If you have heavily uncontrolled bleeding, severe pain, continued swelling after 2 or 3 days, or a reaction to the medication prescribed. The next document we will discuss is informed consent extraction. Informed consent is a modern and ethical process for getting permission before conducting a healthcare intervention on a person. A healthcare provider may ask a patient to consent to receive therapy before providing it. Aligned with the above, please read the following information for informed consent purposes. Potential problems with Loss of teeth. When a tooth is extracted, it often requires replacement with a denture, bridge, or implant. If it is not replaced, the space can cause other teeth to shift and become crooked, affecting your bite and the ability to chew properly. This does not apply to all teeth or in all cases, for example, wisdom teeth. The loss of an important or significant single tooth can have a major impact upon your dental health and appearance. Problems can occur gradually over time. For example, 1. The opposing tooth may over-erupt. 2. The unprotected dental ridge is subjected to trauma. 3. The neighboring teeth tilt and proper bite is lost, leading to tooth sensitivity, wear, broken teeth, jaw muscle and joint problems. 4. The drifting teeth create food impaction areas where decay or gum disease starts. 6. Destruction of the bone will result as teeth drift and tip. Options. If a tooth can be restored and the bone around that tooth is sound, then it is generally advisable to save the tooth. Overall, the benefits of natural teeth outnumber the benefits of prosthetic or replacement teeth. However, if the prognosis, expectation, or prediction of a tooth is guarded, poor, or is non-functional tooth, for example, a wisdom tooth that has significant caries or becomes repeatedly infected, it may be recommended to have such a tooth removed. Extraction of a tooth, whether routine or difficult, is a surgical procedure. As such, in any surgery, there are some risks. Even a simple routine scale and polish have risks. They include, but are not limited to: 1. Swelling or bruising and discomfort in the surgery area. 2. Stretching of the corners of the mouth resulting in minor injury and bruising. 3. Possible infection requiring further treatment. 4. Dry socket, jaw pain beginning a few days after surgery, usually requires additional care, and it is more common in the lower extraction, especially wisdom teeth. 5. Possible damage to the adjacent teeth, especially those with large fillings or crowns. 6. Numbness or altered sensation in the teeth, lip, tongue, and chin due to closeness of the tooth roots, especially wisdom teeth, to the nerves, which can be bruised or injured. This can potentially occur even during root canal treatment or dental implant placement. Sensation most often returns to normal, but in very rare cases the loss may be permanent. 7. Trismus. Limited jaw opening due to inflammation or swelling, most common after wisdom tooth removal. Sometimes it is the result of jaw joint discomfort called temporomandibular joint, TMJ, especially when TMJ disease and symptoms already pre-exist. 8. Bleeding. Significant bleeding is not common, but persistent oozing can be expected for several hours. 9. Sharp ridges or bone splinters may form later at the edge of the extraction socket. These may require another surgery to smooth or remove them. 10. Incomplete removal of the tooth fragments. To avoid injury to the vital structures such as nerves or sinuses, sometimes small root tips may be left in place. 11. Sinus involvement. The roots of the upper back teeth are often close to the sinus, and sometimes a piece of root can be displaced into the sinus, or an opening may occur into the mouth, which may require additional care. 12. Jaw fracture. While extremely rare, it is possible in difficult or deeply impacted teeth. Most procedures are routine and serious complications are not expected. Those which do occur are most often minor and can be treated. To ensure rapid healing and to avoid complications that could be both harmful and painful to you, please follow these post-operative instructions carefully. A. Bleeding. Bite firmly on gauze pack that has been placed in your mouth until you arrive home or for at least 1 hour, and then remove it gently. If after removal bleeding begins again, place another damp gauze pack directly over the tooth socket and bite firmly for 30 minutes. Biting on a tea bag that has been moistened and wrapped in a piece of gauze also helps to stop the bleeding. It is not unusual to have a slight oozing for up to 24 hours. You may find a blood stain on your pillow in the morning. Keep your head elevated with several pillows or sit in a lounge chair. Do not spit or suck through a straw, since this promotes bleeding. Do not smoke or drink alcoholic drinks for 12 hours because this will promote bleeding and interfere with healing. B. Medications. Some discomfort is normal after surgery. It can be controlled but not eliminated by taking the pain tablets prescribed by your dentist. Fill the prescription very soon and start taking as directed. Take your pain pills with a whole glass of water and with a small amount of food if the pills cause nausea. Note, do not drive or drink alcohol if you are taking prescription pain pills, and please note that some antibiotics may temporarily nullify the effects of the oral contraceptive pill. C. Diet. It is important to get adequate nutrition to help the healing process. Eat normal, regular meals as soon as possible after surgery. Cold, soft food such as ice cream or yogurt may be the most comfortable for the first day. D. Oral hygiene. Do not rinse your mouth or brush your teeth for the first 24 hours after surgery. After that, rinse your mouth with warm salt water, half a teaspoon of salt in a glass of warm water every 4 hours. Brush your teeth, but avoid the area of surgery. E. Swelling. To help prevent swelling, ice packs should be applied to the face adjacent to the surgery site. Apply the ice pack for 20 minutes on and for 5 minutes off until bedtime on the day of the surgery. Ice is not particularly beneficial after the first day. Swelling peaks at about 48 hours after surgery and then starts to go down significantly. Significant swelling beyond this point could mean infection. The surgery site may need to be examined to ensure that healing is progressing normally. If stitches have been placed in the area of your surgery, you may need to have them removed in about a week. An appointment will be made for you if this is required. I understand that bisphosphonate medication can increase the risk of bone necrosis by 5%. This is very important to put in the document. I understand that it is vital for me to continue to see my dentist. Natural teeth and appliances have to be maintained daily in a clean and hygienic manner. Yearly examinations are important in case of any adjustments that are required. This yearly examination may include visual examinations, gum probing, assessment, and adjustments of the bite. Normal fees will apply for these procedures. I acknowledge that I have provided an accurate medical history, will follow treatment recommendations, and have had the opportunity to ask questions about these risks. I understand that the fee for my extraction does not include the fee for the restorative work. I certify that I have read and fully understand this document. I hereby give consent to perform the necessary treatment. And finally, the patient's name has to be filled in the document. They need to sign the document. This document needs to be witnessed, and the date and time ideally placed on this document. And finally, this needs to be scanned and added to the patient's file. It is also a good idea that the denter countersigns this document with the following phrase: I hereby certify that I have explained the nature, purpose, benefits, risks, and alternatives to the proposed treatment. I believe that the patient fully understands my answers and explanations. And the same thing, sign, date it, and put it on the patient's file. And most important, handwrite and get the patient to sign the location of the dental extraction. The next document is a crown and fixed bridge consent form, which we provide to all our patients prior to fitting their final work. At the top of this document, the tooth number or teeth numbers needs to be filled in. I understand that the treatment of dental conditions requires crown and fixed bridge work, includes certain risks and possible unsuccessful results, with even the possibility of failure. I agree to assume those risks, possible unsuccessful results and/or failures associated but not limited to the following: reduction of the tooth structure in order to replace decayed or otherwise traumatized teeth. It is necessary to modify the existing tooth or teeth so that crowns or caps or bridges may be placed upon them. Tooth restoration will be done as conservatively as practical. In preparation of the teeth, anesthetics are usually needed. At times there may be swelling, jaw muscle tenderness, or even a resultant numbness of the tongue. Lips, teeth, jaws, and/or facial tissues, which is usually temporary or very rarely permanent. Sensitivity of teeth. Often, after the preparation of teeth or the reception of either crowns or bridges, the teeth may exhibit sensitivity. It may be mild to severe. This sensitivity may last only for a short period of time or may last for much longer periods of time. If it is persistent, notify us. As such, as this sensitivity may be from some other source. Crowned or bridge abutment teeth may require root canal treatment. Teeth after being crowned may develop a condition known as pulpitis or pulpal degeneration. The tooth or teeth may have been traumatized from an accident, from deep decay, extensive preparation, or other causes. It is often necessary to do root canal treatments in these teeth. If teeth remain too sensitive for long periods of time following crowning, root canal treatment may be necessary. Infrequently, the tooth or teeth may abscess or otherwise not heal, which may require root canal treatment, root surgery, or even possible extraction. Breakage. Crowns and bridges may possibly chip or break. Many factors could contribute to the situation, such as chewing excessively hard materials, changes in the biting forces, traumatic blows to the mouth, etc. Unobservable cracks may develop in the crowns from these causes, but the crowns and bridges may not actually break until chewing soft foods or possibly for no apparent reason. Breakage or chipping seldom occurs due to defective materials or construction unless it occurs soon after placement. Uncomfortable or strange feeling. This may occur because of the differences between the natural teeth and the artificial replacements. Most patients usually become accustomed to this feeling in a short period of time. In limited situations, muscle soreness or tenderness of the jaw joints, temporomandibular joint, may persist for an indeterminate period of time following placement of the prosthesis. Aesthetics or appearance. Patients will be given the opportunity to observe the appearance of the crowns or the bridges in place prior to the final cementation. Longevity of the crowns and bridges. There are many variables that determine how long crowns and bridges can be expected to last. Among these are some of the factors mentioned in the preceding paragraphs. Additionally, general health, good oral hygiene, regular dental checkups, diet, etc. can affect longevity. Because of this, no guarantees can be made or assumed to be made. It is a patient's responsibility to seek attention from the dentist should any undue or unexpected problems occur. The patient must diligently follow up any and all instructions, including the scheduling and attending all appointments. Failure to keep the final cementation appointment can result in the ultimate failure of the crown or bridge to fit properly, and an additional fee may be assessed. Alternatives to crown fixed bridge work. Depending on my diagnosis, there might be alternatives to the crown and fixed bridge, such as extractions, dental implants, direct restorations, removable partial dentures, etc. No treatment. I may choose to not have any treatment performed at all. If I choose no treatment, my condition may worsen and I may risk serious personal injury, including severe pain, localized severe pain, localized infection, loss of this tooth, and possible other teeth movement of the opposite and adjacent teeth, and tooth fracture. I acknowledge that I have been provided an accurate medical history, will follow treatment recommendations, and have had the opportunity to ask questions about the risks of continuing with fixed crown and bridge treatment. And finally, the patient's signature, the date and time, and then this needs to be scanned and added to the patient's file. If a parent or guardian, there should also be a witness, and this needs to be dated as well. And finally, the health provider's signature and date. The next document is consent for oral and maxillofacial surgery. You have the right to be informed about your condition and the recommended treatment plan so that you can make an educated decision as to whether or not to undergo the procedure after knowing the risks and hazards involved. This disclosure is not meant to alarm you, but is rather an effort to provide information so that you may give or withhold your consent. Patient's name, signature, and date. The procedure or procedures necessary to treat my condition or conditions have or has been explained to me, and I understand the nature of the treatment to be provided. And then in the patient's own handwriting, they need to write what they believe to be the procedure that they are going to undergo. I understand these other forms of treatment or no treatment at all are choices that I have, and the risks of those choices have been presented to me. My doctor has explained to me that there are certain inherent and potential risks and side effects associated with my proposed treatment, and this specific instance they include but are not limited to post-operative discomfort and swelling that may require several days at home recovery, prolonged or heavy bleeding that may require additional treatment, injury or damage to the adjacent teeth or fillings, post-operative infection that may require additional treatment, stretching of the corners of the mouth that may cause cracking or bruising and may heal slowly, restricted mouth opening during healing, sometimes related to swelling and muscle soreness, and sometimes related to the stress on the jaw joints, the temporomandibular joint, especially when the temporomandibular joint problems already pre-exist. A decision to leave a small piece of root in the jaw when it is removed would require extensive surgery or risk other complications. Fracture of the jaw, usually only in very complicated extractions or surgery, injury to the nerve underlying the lower teeth resulting in pain, numbness, tingling, or other sensory disturbances in the chin, lip, cheek, gums, or tongue, and which may persist for several weeks, months, or in rare instances be permanent. Opening of the sinus, a normal chamber situated above the upper back teeth, requires additional surgery or treatment. Dry socket, which is loss of blood clot from an extraction site, allergic reactions previously unknown to any medications used in this treatment. It has been explained that during the course of treatment, unforeseen conditions may be revealed and may require changes in the procedure. Noted above, I authorize that my doctor and the staff to use their professional judgment to perform such additional procedures that are necessary and desirable to complete my surgery. Anesthetic risks include discomfort, swelling, bruising, infection, prolonged numbness, and allergic reactions. It has been explained to me, and I fully understand, that a perfect result is not or cannot be guaranteed. I certify that I have read and fully understand this consent for surgery, have had questions answered, and that all blanks were filled in prior to my signature. Please ask your dentist if you have questions concerning this consent form. This document then needs to be signed by the patient, witnessed, the date and time needs to be added to this document, including the date and time of the witness. And finally, the surgeon needs to sign, date it, and place this in the patient's file. The next document is a sinus lift consent form. Patient information. Firstly, the patient's full name and date of birth, including the patient's address and contact telephone number and email address. The dentist's full name, the practice name, the license number, and finally the practice address and contact details, telephone number and email. I, the undersigned patient, hereby provide my informed consent for the dental sinus lift procedure to be performed by doctor, and provide your name and the practice details. I understand that the dental sinus lift is a surgical procedure designed to augment the bone in the upper jaw to facilitate the placement of dental implants. I have been informed of the following aspects of the procedure. 1. The nature of the procedure. The dental sinus lift involves elevating the sinus membrane to create additional spaces for bone grafting. This procedure is intended to provide a stable foundation for dental implants. 2. Benefits. I understand that the benefits of the dental sinus lift may include improved dental function, aesthetic restoration, and overall oral health. 3. Risks. I acknowledge that the dental sinus lift procedure, like any surgical procedure, carries certain risks and potential complications, including but not limited to infection, swelling, bruising and discomfort, reactive sinusitis, bleeding, sinus issues or complications, graft material complications, failure to achieve the desired results, damage to the adjacent structures, nerve damage, allergic reactions, and other unforeseen complications. 4. Alternatives to treatment. I understand that there may be alternative treatment options available and have discussed them with my dentist. I have chosen to proceed with the dental sinus lift after considering these alternatives. Number 5. Anesthesia. I understand that the procedure may involve local anesthesia or other forms of sedation as determined by my dentist to ensure my comfort and safety during the surgery. Number 6. Follow-up care. I am aware that successful recovery may require strict adherence to post-operative instructions provided by my dentist. I will attend all follow-up appointments as recommended. 7. Costs. I have been provided with information about the estimated costs of the dental sinus lift procedure and any associated fees. I understand my financial responsibilities and have had the opportunity to discuss payment arrangements with my dentist. 8. Questions. I have had the opportunity to ask questions and my questions have been fully answered to my satisfaction. Heading: Patient's consent. I, the undersigned patient, have read and understand the information provided above. I acknowledge that the potential benefits, risks and alternatives of dental sinus lift procedures have been explained to me. I hereby voluntarily consent to the dental sinus lift procedure. And then the patient's signature, the date and time, and then a witness, same thing, the signature, the date and time, and finally the dentist statement. I, doctor, and you put your name, have explained the dental sinus lift procedure to the patient, answered any questions and believe the patient fully understands the nature of the procedures, including the benefits and risks. The dentist signature and time. This document is a record of our discussion and the patient's informed consent for the dentist sinus lift procedure. Please ensure that the consent forms are tailored to your specific practice, local legal requirements, and patient needs. It is important to thoroughly discuss the procedure with the patient and address any concerns before obtaining their informed consent. Consult with a legal professional for further guidance in creating a legally sound consent form. Dental implants, information and consent form. After careful examination, I have been advised that my current condition might be improved by replacing my missing tooth or teeth with an implant or implants and one or more artificial teeth. The placement of dental implants is a treatment option that acts as a support for new restorations, fixed bridge work, or a removable denture. Restoring lost tooth structure will provide adequate chewing function and speech, create and maintain an aesthetic appearance, and prolong the retention of all sound teeth. There are alternatives to dental implants, including but not limited to no treatment, removable partial dentures for eating and aesthetic aid, crown and bridge work if possible. I understand local anesthetic will be given during the procedure, and some discomfort following treatment may develop from the injection area and from opening my mouth during treatment. I understand that my gum tissue may be lifted and an implant or implants will be placed into my jawbone. I understand that sometimes when there is insufficient bone, a bone graft will be required by either using my own bone harvested from my own jaw and or certified natural bone, mineral, usually of synthetic origin. I understand that sometimes the bone grafts will be covered with my own tissue. However, when this is not possible, resorbable collagen membranes, or less commonly, a non-resorbable membrane might be used. I further understand that if during the surgery, if the clinical conditions turn out to be unfavorable for placement of the implant, my dentist will determine how to manage the situation. It may involve a bone graft plus a soft tissue graft, which may delay the healing process. I understand that some of the problems that may occur are temporary: pain around the implant, infection, tingling and loss of sensation. In rare occasions, altered or loss of sensation in the mandible, the lower jaw, lower lip and lower chin may be permanent, where implants have been placed in the back of the lower jaw. I understand that every measure has been taken to reduce the risk of complications, such as detailed analysis of the bone, nerves and sinus anatomy, using CT scans, 3D computer reconstruction of my jaw and models. I understand that the success of dental implant surgery is high and that the implants or implants is likely to last my lifetime. However, as in any human implant procedure, heart, kidney, artificial knees and hips, no absolute guarantee can be given. I understand that the success of dental implants or implants also depends on strictly following the pre- and post-operative instructions, following oral hygiene instructions, attendance for yearly examinations, and refraining from smoking, regular 6-monthly scaling and polishing, or remaining teeth and or implants are paramount to look after teeth and implants to prevent periodontal gum disease and periimplantitis. Understand that the prosthetic phase of my treatment is just as important as the surgical phase for long-term success of the reconstruction, which is what we desire. Patients who are under 25 years of age will have continued growth in the jaws over several years and may result in change in the alignment of the teeth, resulting in new crowns or bridges to correct the misalignment in the future. I understand that some complications can result from the implant surgery, drugs and anesthetics. These complications, if any, are usually temporary and may include infection, bleeding, swelling, pain, facial discoloration, numbness of the lip, tongue, teeth, chin or gum, jaw joint injuries, muscle spasm, tooth looseness, tooth sensitivity to hot, cold, sweet or acidic foods, shrinkage of the adjacent gum tissue upon healing, resulting in elongation of some teeth and greater spaces between the teeth, cracking or bruising of the corners of the mouth, restricted ability to open the mouth, speech difficulties, allergic reactions, injury to teeth, bone fractures, nasal sinus penetrations, delayed healing, and accidental swallowing of foreign material. Published research indicates that permanent complications are rare. I understand that it is vital for me to continue to see my dentist. Implants, natural teeth, and appliances have to be maintained daily in a clean and hygienic manner. Yearly examinations are important in case of any adjustments that are required. This yearly examination may include visual examination, gum probing assessment, and adjustments of the bite. Normal fees will apply for these procedures. I understand that the complications may arise from my gum disease, and I may be referred to a specialist, example a periodontist, at my own cost. I acknowledge that I have provided an accurate medical history, will follow treatment recommendations, and have had the opportunity to ask questions about these risks. I understand that bisphosphonate medications can increase the risk of implant failure and bone necrosis by 5%. I understand that although smoking is not a contraindication for dental implant therapy, it does increase the risk of implant failure by up to 3 times. If clinical conditions prevent the placement of dental implants, I defer to my dentist's judgment on the surgical management of the situation. I also give permission to receive supplemental bone grafts or other types of grafts. I understand that the fee for my implant stage 1 does not include the fee of the restorative work. In my particular case, I also include the following clauses. I hereby provide my voluntary information consent to Dr. Nunes and his dental team to take photographs of my dental case for planning and teaching purposes. I understand that these photographs may be used for educational training or illustrative purposes within the dental field. These photographs taken may include intraoral, extraoral, or radiographic images of my dental condition. These images are intended to aid in treatment planning, case documentation, dental education and training, scientific and/or clinical presentations. I understand that all efforts will be made to protect my privacy and confidentiality. These photographs will not include any personal identifiable information. I acknowledge that the photographs may be used for educational and teaching purposes by Dr. Nunes and his affiliated institutions. I retain no rights or ownership over these images. I consent to the use of these photographs for an indefinite period of time. I understand that I may revoke my consent for the use of these photographs at any time, provided that this revocation is made in writing to the dentist. I have had the opportunity to ask questions and my questions have been fully answered to my satisfaction. I certify that I have read and fully understand that this document, and I hereby give my consent to perform the necessary treatment. Informed consent for photography, planning and teaching purposes. Patient information: the patient's full name, date of birth, their contact details, telephone number and email address, and their signature. And then the dentist's information: the dentist's full name, the practice name, and the contact details, address and telephone numbers, and then the dentist's license number and signature. I, the undersigned patient, hereby provide my informed consent to doctor and the dentist's full name and their dental team to take photographs of my dental case for planning and teaching purposes. I understand that these photographs may be used for educational training or illustrative purposes within the dental field. 1. Nature of the photography. The photographs may include intraoral, extraoral or radiographic images of my dental condition. These images are intended to aid in treatment planning, case documentation and dental education. I acknowledge that the photographs are intended for the following purposes: treatment planning, case documentation, dental education and training, scientific or clinical presentations. I understand that all efforts will be made to protect my privacy and confidentiality. These photographs will not include any personally identifiable information without my explicit consent. I acknowledge that the photographs may be used for educational and teaching purposes by the dentist and their affiliated institutions. I retain no rights of ownership over these images. I consent to the use of these photographs for an indefinite period, subject to the applicable laws and regulations governing the use of such images. I understand that I may revoke my consent for the use of these photographs at any time, provided that this revocation is made in writing to the dentist. I have had the opportunity to ask questions and my questions have been answered to my satisfaction. I, the undersigned patient, have read and understand the information provided above. I hereby voluntarily consent to the taking of the photographs of my dental case for planning and teaching purposes as described in this document. And finally, the patient's signature, date and time, and the witness's signature, time and date. I, doctor, and you put your name on it, have explained the purpose and nature of the photography to the patient, answered any questions, and believe the patient fully understands the use of these photographs for planning and teaching purposes. The dentist's signature and date. This document is a record of our discussion and the patient's informed consent for the use of their photographs for planning and teaching purposes. Please ensure that the consent document is tailored to your specific practice, local legal requirements, and patient needs. Consult with a legal professional for further guidance in creating a legally sound consent form in your area. Thank you for your time in listening to what I've shared with you today. It's crucial that we support one another by exchanging information to leave a positive impact on this world. If you have any specific topics in implantology that you would like me to discuss, please feel free to reach out. If you find our content valuable, please consider liking and subscribing to help us grow this educational platform. Remember that the road to good health is paved in evidence-based scientific research, and keep smiling.